Belize hasn't recorded a single case of malaria for the past 2 years and is on track to becoming malaria-free if the country can go to the end of this year without a case.
We're on track in terms of meeting targets because our last local malaria case was in December 2018. One of the major criteria for certification by the World Health Organization as being malaria-free is maintaining 3 consecutive years of 0 cases. So if we could reach the end of this year with 0 local cases, then next year we would be eligible to apply to the WHO to commence the certification process, which would be quite a feat for the country and quite an achievement.
Back in the 1990s, Belize had thousands of malaria cases. By the 2000s, more than 70% of all villages in northern Belize had malaria patients. And at around the same time, many communities in the west and south had active malaria transmissions. A robust initiative to eliminate malaria was introduced in 2014. And in years later, Belize's malaria cases went down to a few hundred. And by the end of 2018, the last malaria case was recorded in the country. In 2019, Belize was one of the Mesoamerican countries to implement a new program to target malaria through to the end of 2022. According to the Vector Control Chief of Operations, Kim Bautista, it took massive work and many partners to bring the malaria cases to 0.
Countrywide, we have a network of almost 300 community health workers and malaria voluntary collaborators. Those are the persons that are on the ground. They assist with malaria testing, screening, and from the vector control aspect, we deal with more large-scale interventions like residual spraying in target localities, distribution of insecticide-treated bed nets, the supervision of malaria cases in terms of treatment. So it is sort of a collaborative effort. And that's really what has allowed us to move from where we were looking at hundreds of cases to where it is now.
Bautista says that the COVID-19 restrictions also helped to keep the number at 0 over the past year. One of the things that they must now plan for is the reopening of borders.
You have workers within the migrant workers coming to work, whether it's in the agricultural industry or whether in the service industry. Look in tourism, whether it's construction or other activities, and you have persons coming from endemic areas where these diseases are more rampant. So those and you also factor in significant reduction in illegal crossings as well. I think all of these things played in our favor. So as a ministry, what we're looking at now is two things. We have to look at the start of the rainy season, which results in a proliferation of mosquitoes. And we also need to look at our education campaigns. We also need to look at the doing some preventative groundwork in terms of looking at the data from previous years and to see what are the hotspots that we need to go and engage the public. And lastly, we need to look at plan for the eventual reopening of the borders. As I said, once the borders are open, then it complicates things a little bit. So we need to ensure that all things are in place to mitigate the impact that those factors will have in terms of transmission.
And while the officials will continue to work to achieve a malaria-free status for Belize, members of the public can also play a big part.
It's a small program we run with 62 field officers, and they're the persons that are out there identifying and treating mosquito breeding sites. But the householder needs to meet us halfway, looking at whether it's used tires, uncovered drums, discarded cans and bottles around the home, maintaining the drains flowing in front of your homes. There are several things that as a householder you could do. So realistically, you can't depend on 62 officers to routinely visit thousands of houses across this country. So it has to be a shared responsibility.
Reporting for News 5, I'm Andrea Polanco.